And this is a really fantastic topic to talk about, because very often we concentrate on dogs, we think of dogs suffering from arthritis, but we don't really pay attention to cats, and cats really do suffer from it. It's incredibly common, and so we need to be aware of the signs of pain in cats, and what we can do, because there's so much that we can do to help our cats with arthritis that unfortunately often gets forgotten, it often gets ignored, or it's kind of thought of as an afterthought. Just excuse me, I'm going to turn my heater off because it is really cold in my office. If you've seen any of my updates on Instagram or Twitter, my office is a really cold place. We're kind of in early spring, and yeah, I've just had the heater on, but it's a little bit noisy, so you're probably hearing that as well. So I'll just turn that off. But anyway, arthritis in cats. So how can we recognize pain? That's going to be the first thing. And there's some really easy signs of pain that we can recognize in cats, but unfortunately they often don't show signs of pain or obvious signs of pain until they really are very, very uncomfortable. And that means that we're only picking up the fact that a cat has arthritis often in the really late stages of their disease, when they've already been in chronic long-term pain for years and years in many cases, I believe. So there are some very obvious signs, but generally cats are much more subtle. So if we're expecting them to limp, to really be stiff and sore getting up, and to really show that they're in obvious pain, then we're going to be waiting a long time before we see those signs. So we'll start off with those though. And I've kind of got really 10 main signs of arthritis in cats. So the first one is going to be limping in severe pain, but that really is only going to be in severe pain. Cats won't limp. They're not going to hold their leg up unless they're in absolute agony. So we don't want to be using that as a marker of them starting to be in pain. Now obviously if your cat falls off something high, or if they have a cat bite on their leg, then that's going to be really sore and they're suddenly going to be limping. But from an arthritis point of view, that doesn't happen until really quite a long time into the disease, like I say, when they're already in a lot of pain. So limping in severe pain. Trouble climbing is another one. So that could be up the stairs. So like in Bridget's cat's case, they're struggling to get up the stairs, and that's going to be common. But it could be that your cat usually climbs up up trees, up on the roof. They're really getting everywhere, and they just have difficulty climbing. So that's climbing up is going to be especially a problem with cats with arthritis in their front, in their back legs, as well as front legs kind of pushing down. But climbing down as well, you might notice them hesitating, and then that brings to the next sign of pain in cats, and that's difficulty jumping. So cats, they like to jump from place to place. Cats are really three-dimensional in how they move. So with dogs, pretty much they stay on the ground. They might climb up on the sofa or on the bed, but really they stay on the ground, and we don't have to worry about them going all over the place. With cats though, they are very three-dimensional. They love to explore, they love to climb, they love to go into kind of high nooks and crannies. That's often their safe space. So we can see how they're getting to those places, because very often they will still get to those places, but they just do it in a much more roundabout route. So the classic would be a cat who always used to be able to jump onto the countertop, but they're still getting to the countertop now, but they're going via the chair. So rather than that kind of single bound, effortless bound onto the countertop, they're having to jump onto a chair and then jump onto the counter. That would be a clear example. The other thing that you might notice if they've got arthritis in their front legs and their elbows especially, is they might be hesitating when they're looking to jump down. So they know it's going to hurt, but the only way to get down is to jump down. And so they're hesitating, they're kind of psyching themselves up, building themselves up for that pain when they jump down. So if you notice your cat kind of goes up at a not so high place and they're jumping down, normally they'd cope fine, but they're really hesitating, maybe they're kind of padding their feet, trying to psych themselves up, then that would be a sign that they are struggling and they're likely to be in pain. Now the next sign is a really common one, but it is one that is often missed or not appreciated as being a sign of pain in cats, and that is a reduction in grooming and a cat becoming matted. So if your cat's always been a fastidious cleaner, they've always been grooming themselves, they've always kept their coat nice and slick and shiny and well kept, but they're starting to become a little bit matted, the coat's not looking so fantastic, then yeah, that is a sign that they're going to be in pain. So very often it's a case they can't kind of reach around. So cats will get arthritis in their joints, in their legs, front legs and back legs, but also in their spine if they're having trouble kind of reaching around, reaching all those hard to reach areas. Then they're going to become matted. They're not, and your cat's going to start to look a little bit dishevelled. We might think, well, they're just getting a bit old and a bit lazy, and laziness is something that is often kind of mistaken for arthritis, or it's what arthritis is passed off of is just a normal aging process. But absolutely, a problem with grooming, a lack of grooming is going to be a key sign of pain. It's really hurting your cat because cats love nothing more than to groom and to keep themselves clean. So the next one, which ties into cats getting older and being passed off as just normal old age, is a cat who is sleeping all the time. So, rather than being active, they reduce that activity levels. They also stop playing, they stop interacting with you, and they just start sleeping all the time. And really, this, all of these signs of pain and signs of arthritis in cats all tie into the fact that cats are actually pretty bright and they just don't want to do things that hurt. So they adapt their behavior to make their life easier and make their life more comfortable, especially if we're not doing anything to help them and to reduce their pain. Then all they can do is just reduce their level of activity. Dogs, on the other hand, they love to go for a walk, they love to go for a run, explore, sniff around. So they'll do things even though they hurt and then pay the consequences later with being stiff and sore or having difficulty getting up, or limping. Cats don't do that. They just modify their activity, and as a result of that, they just kind of seem lazy. They stop doing things. They sleep all the time, and like I say, they stop interacting as well. And that's partly because the act of interacting is going to be potentially painful, but also the fact that they could be worried that you're going to hurt them, that you're going to pick them up and that's going to hurt, you're going to stroke them, that's going to hurt. They can anticipate that problem, especially if it has happened a few times. And so they simply stop doing it. So that relationship with you and with the rest of the family also suffers. And then kind of as things get worse, you will get a change in personality, you'll get a change in behavior. So they might start, kind of hissing at you. They might start really warning you. They might actually become aggressive. So if you go near them, they might start lashing out. They might start scratching. If you've got kids in the house, who they're really worried, they're a bit rougher than you might be. Certainly know I've got 2 young children and they can be a little bit rough at times. If your cat's becoming aggressive and they have normally been, really placid, really, enjoying interaction, coming up and looking for attention, sitting on your lap, but they're stopping doing that, and they're even going to attack you, especially if you're trying to groom them because they've come matted, then, that is a marker of pain. And we really need to act. So we need to be aware that there are all these things that cats do, and they really are trying to tell us that they're uncomfortable and they're painful, but we need to listen. We need to be able to interpret those signs of arthritis in cats, and then we need to take steps accordingly. So, let's move on to how we can actually treat arthritis, or how we can go about treating arthritis. And arthritis it is a condition in older cats, but younger cats can get it too if they've had problems with their joints in the past, if they've had hip problems, knee problems, elbow problems, if they've had injuries, ligament damage, if they've broken their legs or whatever it is. If they've had problems, then they absolutely can get arthritis younger. And with our cats living for an awful lot longer, so many cats are going to be affected with arthritis in their life. I forget what the statistics are, but it's a really high percentage. It's something like maybe 60% of cats over the age of 12 suffer from arthritis. It may even be more than that, but it's a really significant proportion. And with cats living longer, I've certainly got patients of mine that are well into their 20s. We need to be aware of this, and we need to be aware that in all likelihood, your cat is going to suffer from arthritis. So we need to ideally act early, because if we act early, we can do more. We can obviously, they're going to be comfortable for longer, but by making them comfortable for longer and taking a few steps, we can also hopefully slow down the progression of this disease, because arthritis really is a progressive condition. It does get worse with time. There's nothing we can do to kind of turn the clock back and to cure arthritis. I guess the only way we could do that would be If a cat just had arthritis in their hip and we did a total hip replacement, that's a potential kind of cure for arthritis. But otherwise, we're managing this condition, we're treating it, we need to expect it to get worse with time. And that means when we're managing it, when we're kind of coming up with a treatment plan, that's a dynamic thing. So we need to be aware that we're going to have to change their management as time progresses. We can expect them to have flare-ups of arthritis where they seem to become suddenly very, very painful, and we have to take steps to really ramp up the treatment that we're giving them. That generally only lasts for a short period of time, and then things will settle down again. But over time, gradually, that arthritis and that level of pain in cats will slowly worsen. So for those of you on the live stream at the moment, if you've got any questions, please leave them in the comment box below, and I'll try and get that. I'm not sure if let me see. Yeah, I can see the chat on YouTube, I think, and on Facebook, I think it's all up there. So yeah, leave me a comment. Let me know what you think, if you think your cat is showing any of these signs, or maybe if your cat's on arthritis and how they're getting on. Also hit that thumbs up and like and all that kind of thing as well, because that just helps other people jump onto this live as well. But anyway, what does an arthritis management plan look like? So there's lots of things. So very often we think of treating pain as giving painkillers and that's it, but that couldn't be further from the truth. There's a whole load of different things we can do, and the more steps we can take, the more interventions that we can give, and some of those are incredibly simple and very cheap or free. The more of those that we can do, the better your cat's pain is going to be controlled, the better their quality of life is, and ultimately the longer they're going to live. Because although you might not think arthritis is a fatal condition, being in chronic pain, being in extreme pain is often a cause of euthanasia. So in a roundabout way, arthritis absolutely is a fatal condition, because we're euthanizing cats and dogs that, had we controlled their disease better, had their pain be better controlled, we wouldn't be in that situation, because their quality of life would still be good. We wouldn't be worried about them suffering, and so we wouldn't have to euthanize them. When they get to the end stage of that arthritis, if it's been left untreated, or just because arthritis gets bad and it can get really bad, then absolutely euthanasia can be the right thing to do. But unfortunately, I think a lot of the time that's premature, just because we haven't taken the steps that we perhaps should have done and could have done, and we haven't recognized it early enough. But anyway, what steps can we take? Well, we need to be sure that we're dealing with that as a diagnosis. So there are other things that can cause chronic pain. We can have nerve damage, spinal damage. We can have cancers. There are other things that can cause chronic pain. So we need to be sure that we've got that right diagnosis before we jump into this, because a different condition may very well need different treatment. The very first thing that I always say, and this is another, as well as kind of pain and arthritis, another kind of bugbear of mine, if you like, or another passion of mine, is weight management. So many of our cats and dogs are overweight or obese at the moment, and absolutely the best thing that we can do, in my opinion, if possible, and if your cat is overweight, is to help them lose weight. So if you imagine that every step that you take, you're carrying extra weight, you're putting extra load on your joints, you can imagine then that those joints are going to suffer more inflammation. They're going to degrade and get that inflammation, and the damage is going to get worse an awful lot quicker. So if we can reduce the weight, now we don't have the data for cats, but we know in dogs, if they lose only 6% of their body weight, that results in an improvement in their comfort levels. So 6% body weight is not a huge amount. And for a dog who's obese, it may very well, 6% will mean that they're still obese, but we know that if they lose that small amount, then it will make a big difference in their comfort levels. And then the more that they lose, the more comfortable they're going to get. And there's no reason to suspect that cats are any different. And absolutely, cats are suffering from the same level of obesity as dogs are. So the very first thing any weight management, any arthritis management plan should tackle is weight management. Now, that's not to say weight management is easy. It can be very challenging, especially in cats who are in pain and are otherwise inactive, but it's absolutely something that you can do. And it's free. You've got to feed your cat anyway, so feeding them an appropriate diet, and we'll come on to diet in a minute, trying to encourage them to exercise in an appropriate way. And again, we'll come on to exercise, but just being aware of that. And for those of you whose cats don't have arthritis and they're absolutely fine, but are a little bit on the overweight side or a lot on the overweight side, and you really need to be honest with yourself about that. If your vet said that your cat's overweight but you don't believe them, trust me, your vet will be right. Take steps to help them lose weight before they develop any complications with that obesity. So that could well be arthritis, but it could be diabetes, it could be kidney disease, it could be skin disease. There's so many different things that obesity results in. So anyway, that's that. This is a rant for another day. You can tell it's something that I feel very strongly about. So weight management's number one. Now nutrition is number two. So we know that feeding certain things and certain diets can have a big impact. And actually, when it comes to all of the different supplements that there are for our pets with arthritis, actually the thing that has been proven to have the best effect on our pets in improving their comfort levels is to feed them a joint-specific diet. So those joint-specific diets contain a few different things. They've got things in them that are essential fatty acids. So our omega-3 fatty acids, which come from a marine source, so our fish oils effectively, they have a really good anti-inflammatory effect. It's not the be-all and end-all by any stretch, but they do have an anti-inflammatory effect, and that's been proven. These diets will also contain glucosamine and chondroitin as well, which are other joint supplements that haven't got quite the same level of evidence behind them as the omega-3 fatty acids. But when all of these things are combined in the diet, then we know that that does definitely make a big difference. They also do have things in them that help prevent weight gain, help encourage weight loss and help encourage a healthy weight, help also to maintain muscle mass. So another problem that we get with cats with arthritis, and especially cats with arthritis that we're trying to lose weight, or any cat that's trying to lose weight, is that they can get a reduction in their muscle. So if they're not using their muscles, then they lose their muscles. Use it or lose it, and it's exactly the same with an arthritic cat. If they're not using their muscles, then they atrophy. And they get much smaller, they shrink, and then that causes problems, knock-on effects with instability in the joint. So anyway, that's by the by, these diets will help maintain that muscle mass as best as possible. It will help in all kinds of different ways. So there's a few different diets that are available there, but that's the best thing that we can do. We certainly want to be avoiding high fat diets because that's going to encourage weight loss. If you don't want to feed an arthritis specific diet, you want to give supplements instead, then I definitely encourage you to feed a lighter diet. Maybe feed a weight loss diet rather than an arthritis diet if your cat is really overweight. That might be the best thing. But having a chat to your vet about all of these things and all of the other things I'll be discussing, is really important, so you can tailor this arthritis treatment plan to your cat specifically, because there is no one size fits all, and it might be for some in the early stages of the disease. You can settle down their current bout of their flare up with arthritis with some painkillers, which I'll come on to, but you might be able to maintain them very well either with dietary management, feeding them that specific diet, or by giving a supplement. So the supplements that are out there are numerous. So yeah, like I say, there's the just feeding the fish oil, so our omega-3 fatty acids. There's cod liver oil. There's green-lit muscle extracts, which again are a marine source of omega-3 fatty acids. There's our glucosamine and chondroitin supplements, which probably have some benefits. Jury's a little bit out, and definitely the other thing with supplements is that they can vary hugely in the quality that they provide. So it's really not a very well controlled market. It's not very well regulated, and it's been shown that some supplements really have next to nothing of the ingredients that they claim to have in them. So you really want to be careful about where you're sourcing these products from. Clearly I'd recommend talking to your vet about which products they think's best depending on your local market, because that's probably going to vary depending on where you are in the world. Other supplements that are out there, you'll have seen turmeric supplements. Well, curcumin, I think it's called. That's not right, but the active ingredient escapes me. But yeah, turmeric. That's really not been proven, and really high. The active ingredient in turmeric is actually found in very small quantities if you're giving just a turmeric supplement, and so you really need to give ridiculous levels of that to have any potential effect. But it's not got any good benefit to my knowledge that's been proven in good studies. It may well help, but don't hang your hat on that. And then there's all kinds of other ludicrous and ridiculous supplements out there. There's a lot on the market that make bold claims, but really there's very little evidence behind them. And unfortunately, time and again, I do see people who have spent sometimes an awful lot of money giving their pet, a cat or their dog, these supplements, which haven't really had the benefit. They've owners, through no fault of their own, they've asked advice, they've gone online, they've had a little look, and they've made their decision. But really, they've been sold a false hope, a false dream that this very simple and natural thing is going to make a huge difference to their cat. And unfortunately, it means that they've wasted an awful lot of money, which can have a knock-on effect later on when it comes to affording other treatments. It might be that you've spent most of your budget on things that don't work, and clearly that's not a situation that any of us want to be in. But it's also meant that your cat has been left untreated and in pain for longer than they necessarily have to have had. So I'd encourage you, rather than looking for miracle cures online, people saying that X, Y, or Z will help, a lot of the time those really are unproven, and there are better ways that you can spend your money. Which isn't to say that supplements don't play a role, they absolutely do, but only the right ones and only in the appropriate cases. And very often, certainly later on in the disease, supplements alone are never going to be the only thing that your cat or your dog should be having, because it's not going to be enough. It's not going to control their pain enough. So that's supplements. Environmental modification. Now, this is a huge topic as well. There's a lot of things that we can do to manage a cat's environment just to help keep them more comfortable, to help them live a better, engaged, more fulfilled life, a better quality of life, but also to reduce the actual pain that they're in and improve their comfort levels, and also to reduce the rate at which their arthritis is deteriorating. So if, for example, you're feeding your cat on a countertop, it might be really uncomfortable for them to either get to that food or to get down from wherever they're being fed. So putting their food on the ground. Equally, litter trays. So a common sign of arthritis in cats that I didn't mention before is that they might stop using their litter tray because the lip of the tray is just too high, and so they struggle to get in. It's too uncomfortable. They might get in with their front legs, but their back legs are left hanging over because it's just too comfortable. So they're trying to get there, but they just can't make it. It's just too painful. So using a bigger tray with a shallower lip, maybe having a ramp going up into it, can definitely help as well. You want to be ideally having safe spaces low down. So if they used to like going into the cupboard, going up to the top of a wardrobe or something, and that's their safe space where they could relax, where they could withdraw, deal with any stress that they're suffering from, which again is a common problem in cats, then you could move them to another space, put a bed down somewhere else, maybe under your bed, somewhere that's really easily accessible. If they use a cat flap and they rely on that to get out, to go to the toilet and to explore the outside world, then that can sometimes be in really difficult places. I certainly know cat flaps that have been kind of in top windows, and the cat's had to go onto a windowsill, go through the cat flap, kind of perch on the window ledge, and then jump down. Now that's going to be really impossible for an older cat with arthritis. So thinking about cat flaps, also the size of the flap and that kind of thing, but also it may be that you actually just have to let your older cat out, supervise them for a period of time, and then make sure they come in, so that they're not having to use that cat flap. If they like going on the sofa, and again to improve their interaction with you, well, absolutely you can lift them up. You need to be a bit gentle, clearly, but lifting them up rather than making them jump up and encouraging them to jump onto your lap. So just helping them that way. So there's a whole load of different things that we can do to modify their environment, and really it boils down to making everything more accessible for them, and also reducing the amount of activity that they're having to do and the impact on their joints to get to different places and to do the things that they want to do. So, other things to modify the environment, having nice, soft, comfortable bedding, ideally, something that conforms. Now, that's not so much of a problem with cat, just a nice, thick, plush blanket or normal cat bed will often be enough, but you might want a little foam, foam underlay, or even a memory foam underlay, just so that there's no pressure on joints, on bony bits as well. Remember that your arthritic cat is likely to be more bony. So, there's those things that we can do. You might want to put a heat mat in as well. So heat can just help improve comfort levels and, stop your cat getting cold and seizing up. There's all kinds of different things we can do there. Complementary therapies is the next thing. Now, there's a whole load of different things, and physical therapies definitely help. So that's massage therapies, physiotherapies, hydrotherapies, and dogs. It's unlikely a cat's going to want to do that, but I certainly have known of cats that are really quite happy doing hydrotherapy. That provides a great low impact activity that's it's going to help burn their calories if they are overweight. It's going to be helping them kind of maintain their muscle mass. And it's going to provide some mental stimulation for them as well. And mental stimulation is important, for a cat who is sitting doing not a lot or not as much as they'd want to do. Making sure that they are mentally stimulated is really important just for their quality of life, and that can be just with how you're feeding them or giving them different toys. Different ways that you're engaging them as well is important. So that's one thing. And then the next thing, and the big thing, I guess, is, and the one thing that I said that we all think of, is painkillers. So painkillers is a little bit of a touchy subject, a controversial subject. It shouldn't really be, but it is, especially online, and especially if you're reading things online about painkillers in cats. So the big one and the main one that we use, or certainly that is used in the UK and in Australia and New Zealand, will be Metacam. So that's meloxicam, which is a non-steroidal anti-inflammatory drug, or an NSAID, you might hear it said, or a non-steroidal. There's lots of different names, but yeah, that's Metacam. Now, the reason I say that this is controversial, because in the US there is what we call a black box warning on the Metacam label, and it says something like repeated use of meloxicam in cats can potentially cause renal failure and death. Do not administer additional treatment, injections, or oral Metacam to cats. So that is clearly a pretty serious warning. The flip side is that in the other countries, so that's in the UK, in Australia, in Canada, I think Canada has oral Metacam for cats. In New Zealand, there is oral Metacam for cats. So how can it be so dangerous for cats in the United States of America and yet used so regularly in these other countries? I think there's a lot involved in that. There's the potential litigation aspects, and yeah, I've never practiced in the States, so I wouldn't like to say exactly how that warning came about. But the bottom line is that the vast majority of vets will be quite happy to use Metacam, meloxicam in cats with arthritis, but we absolutely have to use it appropriately. So it is not ideal, and it is not appropriate for every single cat. It can cause kidney failure and it can cause death, but it also offers our cats the best opportunity to live a pain-free life, to live a life with a good quality, and so to live a longer life as well. And actually there have been studies done. Now, there are limitations to these studies that I'll mention, but there have been studies done that actually show that cats with existing kidney failure live longer when they're given Metacam. So that's cats with existing kidney failure that have arthritis. They live longer when they're giving Metacam. Now, the limitations for that is that study, although it was done in general practice, it was funded by the makers of meloxicam. So there's clearly a conflict of interest. Now, that being said, we shouldn't cut our nose to spite our face. That's really interesting. I absolutely would love that study to be repeated, and hopefully it will, because it's a really important one. And it is a few years old, that study. If I think rightly, it's maybe 5 or 6, even more years old. It might even be 10 years old. I'm not sure. It's amazing how quickly time goes. But yeah, that's really, really interesting, I think. So when is Metacam dangerous? Well, Metacam, absolutely, meloxicam are non-steroidals in general. They inhibit what we call COX enzymes. Now, some of those COX enzymes are involved with inflammation and pain, and those are our COX-2, what we call our COX-2 group. The COX-1s are due to dealing with homeostasis, so the normal function of the body, and that includes maintaining blood flow to the kidneys, blood flow to the intestines, and all kinds of things. So if you've got a cat who is unwell, who has kidney disease, if they're dehydrated, their blood flow to these essential organs is potentially compromised already, absolutely giving them Metacam, giving them meloxicam is going to be a bad idea. It's potentially going to cause them to go into acute renal failure or acute on chronic renal failure, knock out their kidney function, and they're not going to recover from that. So, we absolutely need to be careful of giving Metacam to cats. But in a cat who is otherwise doing well, they're eating, they're drinking, they're not vomiting, they don't have diarrhea, there's no reason to suspect that there's any other health problems involved, if their kidney disease is stable, so if it's not progressing at a rapid rate, if their then that's going to be detected by, maybe what their weight's doing, repeat blood tests just to monitor their levels over time, which you're going to want to be doing anyway for a cat with kidney failure. Monitoring their urine, doing different urine tests, how much protein's in their urine, all kinds of different things. What's their blood pressure like? If they're stable and they've got kidney disease, almost so what? We need to be monitoring that, but we need to be monitoring that anyway. And actually, if they're in pain, then we need to do something for that pain. Now Metacam. So you'll have gathered from this that yes, I think Metacam absolutely is appropriate for cats. It should be considered for every cat with arthritis. Now, that's not to say it's going to be given to every cat with arthritis, absolutely not, but it should be considered, even if it's just to say, should we give Metacam? No, we shouldn't. Let's use an alternative, and it's as quick as that, but we should consider it, and in the majority of cases, in most of cases, it is going to be appropriate. So anyway, that's that out of the way. There are other painkillers that we can give as well. So there's gabapentin, there's amantadine. They can have a really good pain effect. Now, another one that you must never use is paracetamol, or acetaminophen, I think you call it in the US. So paracetamol is fatal in cats. Now, you can use it in dogs, and it can be used appropriately and very well, and it can be very effective in dogs, but never, never, never give paracetamol to your cat. It will kill them with a tiny dose. So just, never do that. So never be tempted to give your cat one of your painkillers, or something that your vet hasn't approved, because paracetamol will kill your cat very, very quickly, very easily, with a very tiny dose. So don't do it. But if you're giving your cat ibuprofen, if you're giving them aspirin, again, you can cause some real problems there. So those are also non-steroidal drugs, not the paracetamol, but the ibuprofen, the aspirin. There's various other ones. They are non-steroidals. They have a really low safety margin, so definitely don't do that. Just don't. So that's kind of like a run through of the treatments. Now, there are surgeries as well that we can give. Now, I mentioned total hip replacements, and to be honest, I'm not sure. I don't think they're done in cats. Now, I might be wrong with that, but I don't think that they are. That's a specialist procedure anyway, if they were doing that. But I don't think they do. I think it's just dogs at this stage. It might be something that is being done in a few select places, or something that becomes available later on. But yeah, it's not something that we're doing. And the case selection for that would be really challenging. If a cat's got bad arthritis in their knees, if they've got that bad arthritis in their elbows, then probably it's not going to be worthwhile going down that route anyway. Some cats will have bad arthritis in their hips, if they've had a fracture or if they've had some other problem, and we can do something called a femoral head and neck excision, or femoral head ostectomy, where we actually remove the ball joint from the hip. And yeah, that actually cats do pretty well with that. It's a salvage procedure. It's not ideal. It's not something that we would kind of jump into doing, but it's certainly something to consider. So that's really a brief run through of a treatment plan for arthritis, how to treat your cat with arthritis, and you can see that there's a lot involved in that. And so the next thing that we need to do is we need to we monitor, we modify, and then we maintain. So the 3 M's. So we monitor the effect that treatment plan is having in our cats. Is it doing the job that we want it to do? Is it helping them to be as comfortable as possible? Is it working, but actually things are starting to slide? Can we do better? What are we expecting? What are the results? And what should we do as a result of that? Now, so we've monitored, we're modifying. So we're then going to change our treatment plan. It might be that we start off giving a whole load of things because a cat has come in really painful. They've had an acute flare up of their arthritis, and we're giving them a lot. And then we're modifying the plan. That's worked. We're modifying the plan. We're slowly removing different things. So it might be they started off with, we started them on a supplement, we started them on a diet, we started them on a weight loss plan, we started them with anti-inflammatory painkillers, so our non-steroidals. It's had a great job after 3 or 4 weeks, and then we start removing that Metacam, that painkiller, to see if everything settled down and all the other changes in the house has done the job that we need it to do. Once we've modified and we're happy that our arthritis plan, we've then monitored for what those changes have done. Once we're happy, we then absolutely need to maintain it. So what can happen, and what I've seen, is that our cats, they're controlled, they become comfortable, they start to do really well, and we then go, oh well, they're doing really well, let's stop giving this supplement because it's costing whatever it's costing, or let's stop giving this anti-inflammatory, even though we know that they need it because we've tried taking them off it before. Let's stop that. Arthritis, it doesn't get better. We can control it, and once that inflammation is at a low level, we can absolutely control it, but we need to keep it at that low level, and we need to keep it controlled, because if we take everything away, it's all just going to come back, and once it comes back, it then becomes harder to treat in the short term. It takes longer to get our pain levels under control, because the longer pain goes untreated, the longer it takes to get that inflammation, those pain levels down, because the nerves suffer what we call a wind up, where they get hyperalgesia, which means that they become super sensitive to pain. So things that used to be a little bit painful become very, very painful. And then they also get something called allodynia, which is where things that weren't painful or shouldn't be painful actually become painful and interpreted as pain. So we don't want to get into a situation like that, although that's often the situation we're in at the very start of treatment. But if you've started making changes and instigating different treatment modalities, then we don't want to ever get back to that stage if we can absolutely help it. So we want to monitor, we want to modify, and then we want to maintain that treatment for arthritis. And by doing that, we're going to give our cat the absolute best chance that they have of being pain-free for as long as possible, for as much as possible. We're going to slow down that progression of their arthritis, and they're going to live longer, happier lives. And that's really what this is all about. It's all about what we want for our pets. They're family members after all, and it's what we want as vets. We want our patients to be as happy and as healthy and as comfortable for as long as possible. So if you've got any questions about arthritis, then please just leave me a comment. If you're on live now, just leave me a comment. But if you're watching the replay, again, just leave me a comment, and let me know what you think. What have you done for your cat that made the biggest difference? How what changes did you make in the house, or what supplements are you giving? All that kind of thing. Let me know, and I'd be really interested to hear your experience. But also, if you've got any questions about that, then please just leave that. Now, I also, for those of you who have cats with arthritis, I do have a free arthritis course that you can sign up to just by going to ourpetshealth.com/arthritis mini course, and that will be that's all one word, arthritis mini course. The link is in the description, in the comments there. So go and check that out and sign that out. It goes through a lot of the things that I've discussed today in a lot more detail as well. So definitely sign up for that course. I'm sure you'll find it valuable, and I'm sure it will help you keep your cat as comfortable as possible. So that's ourpetshealth.com/arthritis mini course. So yeah, that's it for that. I could have spoke for a little bit longer than I anticipated for, than I'd planned for, but yeah, it's a really important topic. Excuse me. So I'll just try and get to some of the questions that were asked by people who couldn't make it on the live stream. Now, they're not all arthritis related, but I'll do my best to just give a quick answer for those and give the information that hopefully will make a difference for you. So Christina, she said, my cat is long haired and I've noticed sometimes poop gets stuck in her fur. She's very sassy with people. She doesn't know that she doesn't know, which I'm sure she won't tolerate getting a haircut from a groomer. Do you have any advice on this? So yes, I guess why, well, there's a few different things here, isn't there? There's why is she getting her poop stuck on her fur? Is it because she's got long-term diarrhea? Are her stools quite soft? Has she got intestinal problems that we need to be addressing? Is it just because she's a long-haired cat and ideally she just needs to be kind of kept short around the back end? Is it because she's not grooming herself well, and that's why it's happening now? I'm not sure how old your cat is, Christina, but if they were always keeping themselves clean before, it definitely goes back to what I was saying at the very beginning about the signs of arthritis in cats and a lack of grooming, becoming matted, maybe the coat becoming unkept, and in this case, absolutely kind of getting poop stuck on the back of their fur could be a sign that they're in pain, because that's a really hard place to reach. You can imagine if you have to bend round and clean your bum, it's going to be difficult for a cat with arthritis because it's really going to be sore. So also, that could be why they're being a bit sassy, with people that they don't know, because they'll tolerate it with you because they've got a relationship with you. But with people who they don't know, why should they tolerate that? There's absolutely no reason, and fair enough. So, what's going on? Why is that a problem? Equally, if it's a young cat, they've always, their stools are normal, but they're just really long haired and they're really, struggling to stay clean, then you might actually be surprised that how much your groomer will be able to do with your cat, because when they're not in their own environment, they can behave very differently to when they're at home. I certainly see that all the time in the vet clinic, that an owner, there's absolutely no way they can cut their cat's nails. There's no way they can give them a tablet. Clearly it's something that I'm used to doing on a daily basis, and the veterinary team and also the groomers would be used to doing on a daily basis. So we know how to do it. We know how to handle the cats, and it's not on their home territory, so they're not quite so confident, and we can get that done without any kind of objection from the cat. So you might be surprised, and certainly might be something that you want to try. But we want to make sure that they're healthy first, which goes back to all those potential problems. Now, if your cat is really stressed, well, if it's just kind of clipping a little bit of their kind of the fur around the bum, and they're not particularly matted otherwise, and otherwise they're keeping themselves kind of well groomed, then you could get yourself a cheap pair of wireless clippers. Certainly we use some in the clinic that are really very inexpensive, and they do a great job. They're very quiet, and most cats won't object. So you could just gently trim. Now, you could use scissors as well, but do be a little bit careful when you're using scissors to groom your cat, because it's certainly not unheard of for people to cut their cat's skin, especially if they are a bit matted, because you're trying to get right down close to their skin where the fur isn't so matted, to get that whole mat out. And people do clip their cut their cat's skin that then needs to be stitched up, and had surgery and all kinds of different things. So just be a little bit careful if you're doing that. But you might be surprised about how much you're able to do, certainly if you're distracting them otherwise with some kind of treat. And absolutely you can use something like licky mats or something like that with a cat, just to distract them and keep them busy at the head end while you do things at the back end that that aren't really causing any discomfort or distress to your cat. So you might definitely try and do that. There are also other ways that you can reduce stress when you're taking your cat to somewhere else. So that could be the groomer, but it could be the vet. I've done a video. So Christina, you asked me this on YouTube. So if you go onto YouTube, I do have a video about reducing your cat's stress when you take them to the vet. I forget exactly what the video is called, but it's something like, if you type in probably stress vet visit in the search, it will probably come up. So that will absolutely help, and there's definitely things that you can do so that they're a little bit more relaxed when they get there, and less likely to object to having everything done. Now, if they are really matted, it might be that they do need to be sedated at your vets, and they need to have a full-on clip out to get things back to normal for you to then start to be able to groom them. So yeah, I guess those are my kind of brief suggestions about that, Christina. So hopefully that will help a little bit. So yeah, the bottom line is we want to make sure that there's nothing underlying that's causing this problem. And then if there isn't, there are things that we can do. If there are, then absolutely we can treat those, and hopefully that will resolve the situation as well. Other questions that were asked were Anna Rude, and apologies, I probably pronounced your name horrendously wrong. But they asked a couple of questions. So the first is how to prevent hair loss and redness in a cat. And the second one, is it required to vaccinate cats? So let's take the vaccination question first. It's not quite the arthritis questions that I was meaning, but we can talk a little bit about vaccinations. And actually, if you no, Anna Reid, you're on YouTube, but I did put I did a live stream last week. I think it was all about vaccinations and how often we need to vaccinate and what vaccines do we need. So if you head over to Facebook, so it's Facebook, facebook.com/ourpetshealthtv. That's the Facebook page. You'll find the live replay there. I am going to post it on YouTube at some point as well, so keep your eyes out for that. But and I've also done lots of videos about vaccination, so definitely search for those as well. If you just go to the YouTube channel, click on the Our Pets Health YouTube channel link that will be down here, and search for the vaccines. But is it required to vaccinate cats? Yes, is the short answer. But what do we need to vaccinate? How often do we need to vaccinate? Well, the core vaccines are cat flu, so our herpes virus, and calicivirus. So those are the two main cat flu viruses that we need to vaccinate for. And then something called panleukopenia, or maybe feline parvovirus. You might have heard it called that. But those are our core vaccines that are a risk to pretty much every cat. And absolutely all cats should be vaccinated for that. They should at least have their initial course. The initial course for vaccinations for cats and for dogs is generally we start at 8 weeks, can start at 6 sometimes, but we generally start at 8 weeks, give them every 4 weeks, with the final vaccination at 16 weeks of age. We then give another vaccination 6 to 12 months later after that vaccination course, and then they become a 3-yearly vaccination. We know that they'll last for at least 3 years. Now, there's an argument that they may last longer. They certainly might. Probably not so much in cats with the cat flu. So the cat flu vaccines are not the most fantastic. They will not 100% prevent disease, but they will reduce the severity of that disease. They'll reduce the frequency of flare-ups, because those viruses, if a cat's got them, they tend to stick around for a long time, if not lifetime. So herpes virus is what causes cold sores in us, and once you've got that, you've got it, and it flares up when you get stressed, when you get a bit run down, and it's the same with cats. But vaccination will absolutely help with that. So those are our core vaccines. We then have, and for those areas where there's rabies. Now, rabies is also a core vaccine, and sometimes some places it's going to be a requirement by law, depending on where you're living. And there's going to be legislation around that about when you need to vaccinate, how often you need to vaccinate. So, you definitely need to know about your local requirements there. But there are other kind of more lifestyle vaccines, if you like. So the big ones here are going to be FIV, so feline immunodeficiency virus, and FELV, or feline leukemia virus. Now, if those cats that are either living with other cats with those diseases, or those cats that are going outside and there's lots of other cats around, because that can be spread by fighting, that kind of thing. So if that's in your area, also they're not everywhere in the world. So here in New Zealand, we've got a lot of FIV, but we don't have a lot of FELV. So we've got a lot of feline immunodeficiency virus, but not a lot of leukemia virus. Now, in the UK, the situation is somewhat reversed, and there's a lot of leukemia virus, but not so much FIV. So, knowing what the risk in your local area is important, as well as the lifestyle of your cat. If your cat lives by themselves or with one other cat who doesn't have that virus, and they don't go outside, then they're not going to need those vaccinations. Chlamydia is another vaccine that may need to be given if your cat, especially kittens, more kittens than older cats, but could be, if they're living in big colonies of cats and big shelters. Those are going to increase the risks of that disease. So it all depends on kind of what vaccines, what diseases are in your area, kind of the lifestyle that your cat lived. But yes, I certainly do think that cats need to be vaccinated for those core vaccines. Cat flu is incredibly common. Panleukopenia, well, I would say up until a couple of years ago, I'd never seen panleukopenia, but you may have seen there's been news recently that vaccine levels have dropped, certainly in the UK, and I imagine it's elsewhere, because there's all this anti-vax movement, and people are unnecessarily worried, in my opinion, about the side effects of vaccination. So vaccine levels have dropped, and we're starting to see all these diseases. I mean, you only have to look at the human situation with the measles outbreak at the moment that's going on across the world. What happens if we stop vaccinating? We get all of these horrible diseases, and I've certainly seen panleukopenia a few times in the last couple of years in kittens that have died as a result of that. They're incredibly serious diseases that we need to protect against, and we need to stop those happening, because they're so preventable. And the risk of vaccines, there is a risk of vaccines. Anyone who says there's no risk of vaccines is lying, but no one who believes in vaccines would say there's no risk, but the risk is very, very low. And again, I've talked about that at length in different videos, so definitely check that out. So that's the kind of the vaccine question. Kind of hopefully, that kind of gives you a little answer for that. And then how to prevent hair loss and redness in a cat. So skin disease is a huge topic as well, I'm afraid. What's causing that hair loss and redness is going to be the big thing, because without knowing that, there's all kinds of different things that can cause that, and there's nothing that I can say that will say, well, just do X, Y, and Z. Is there a flea allergic dermatitis? That's incredibly common. Cats will, often lose hair. They'll overgroom themselves. They'll maybe have little kind of scabs around. It might only take one flea bite, so you might not necessarily even see signs of fleas on your cat. Do they have an allergy to something else? Do they have an environmental allergy? So an atopy. If we think of that as like hay fever, for cats and dogs. Dogs get it much more often than cats, but cats certainly can have allergies. Do they have a skin infection that actually they had a minor problem that became a bit infected, and that's causing the problem? Do they have a hormone abnormality that's causing their hair to fall out? or for them to overgroom? Are they stressed? And that often causes cats to overgroom. So there's all kinds of different things that can cause hair loss in cats, and can cause red skin in cats, can cause them to overgroom, and cause them to be itchy. I have done a video on hair loss as well, so sorry to just keep passing you off to other videos, but yeah, these are all really big topics that I've kind of discussed at other points. So if you look at, search for hair loss in cats, you'll definitely find that as well. So that's it for me, really. So yeah, we've kind of gone through a lot with the treatment of arthritis, with the signs of arthritis, and that's always going to be the first thing. So many of our cats, the bottom line is that so many of our cats have arthritis that is untreated, and they're living in untreated and unnecessary pain. If we can recognise the signs of that pain, then we're going to be able to give them the treatment and the care that they need, and the care that they deserve. So make sure that you know about the signs of pain in cats and the signs of arthritis in cats, and then understand that there's so much that we can do to help them, to treat them, to keep them comfortable, to slow down the progression of their disease, and to provide the best care possible. So yeah, if there's no more questions now, I'm going to jump off. Like I say, leave me any comments if you're watching on the replay. I hope you found that helpful. Leave me any comments. Also, make sure you share this video, hit the thumbs up, hit the like. If you're on YouTube, make sure that you're subscribed. Make sure that you like the page on Facebook as well. And also, I've got that free arthritis course for you. So ourpetshealth.com/arthritis mini course. Links are all in the description. But that's it from me. Hope you have a great day. And yeah, I'll see you soon. Okay, bye. Oh, not bye. I don't know how to end this. There we go. Yes. Okay, bye now. I've worked out how to stop streaming. Okay, cheers.